Now we're going to review nervous system changes in geriatrics and how we're going to accommodate those changes as licensed massage therapist. This almost hour presentation video that I'm going to show you right now is part of a larger course at CE Institute where we teach CE hours for licensed massage therapists and other healthcare workers. Now, in this training, you might hear me reference things such as workbooks or handouts or downloads, and that's because this is a video training unit of a larger home study course that our students pay to take here at the school. If you want to take this training or a greater amount of training in geriatric massage and bodywork or any of our other subjects, feel free to register for that training at ceinstitute.com. In the interim, we're going to share this training unit here that's part of our home study training. And I'm just going to ask you to disregard any time that I mention a handout or workbook or download or anything like that, because this is being provided for free on YouTube. And we only have the downloads and handouts as part of our paid training. So we hope you will enjoy this portion of training that we provide here at the school for free here on YouTube about changes in the nervous and endocrine systems in geriatrics. Our nervous system atrophies as we age. As we age, the nerve cells themselves pass messages from the peripheral body, the arms, legs, trunk of the body, to the central nervous system, to your brain more slowly. So they might not be able to react or respond as quickly. And for examples, a client might touch a hot radiator or something really sharp in your practice, and it could cut them or burn them. And they might not realize they're being cut or burned very quickly because they can't really feel it. It takes an extra long second, more so than when we're younger. So we really need to make sure that our treatment space is safe for the client. There's nothing sharp or hot, nothing that could cut them or burn them, because if they do come in contact with this, especially if they have lost cognitive abilities, with the central nervous system, it's really hard for them to respond or react accordingly, and that can contribute to greater injury. Because our entire nervous system atrophies as we age and get into our golden years, we're literally losing nervous cells and tissue as we age. This can cause a geriatric client to have either a reduction or full loss of reflexes and senses in certain areas of their body or with their cognitive ability, with feelings of pressure, with feelings of temperature. And some of this nervous lost sensation can affect a geriatric's ability to move as well. It creates mobility problems. They don't feel safe or secure because they can't really feel where they're at because their nervous system is no longer responding like it's used to. It's also thought that our nervous system is literally bathing in the waste products of the body. The lymphatic system, the circulation of your cardiovascular system, all are much slower and even sluggish as we grow older. And it's thought that these waste products can help the nervous tissue deteriorate. It has a negative effect on the nervous system, on the nerves themselves. So as we age, as we have less tissue metabolism, slower tissue metabolism, that also affects the intertwining nerves in the tissues. Now, as our geriatric clients age with that peripheral nervous system deterioration, where they cannot feel as much, whether it's on their back, their legs, their arms, or all of their body, we have to be really careful of what we choose to practice for a modality with our geriatric clients. I don't recommend modalities such as cupping or hot stone massage because the client needs to provide critical feedback to ensure safe treatment. If you put a cup on a geriatric client, not only is the skin really loose and it probably won't hold very well, but you'll probably apply more pressure to try and get it to hold. But if the client can't really feel that pressure, they could be severely marked. And there could even be skin fissures, bleeding, which can lead to skin ulcers and infection. With hot stone massage, geriatrics can often be burned because their skin is thinner and they can't really feel the heat probably until it's too late. So whenever you're working on a geriatric client and they have a diminished nervous system capacity to feel, you really need to figure that out prior to applying your body work. You don't want to do deep tissue or trigger point if they can't really feel what you're doing, because that could be harmful to your geriatric client. With the central nervous system, it's very common to be forgetful as we grow older, but some geriatrics have cognitive impairment abilities where that exceeds what normal memory loss would be. There are many different types of cognitive impairment and central nervous system deterioration for geriatric clients. Dementia is a central nervous system condition of the brain that causes our geriatric clients to lose the ability to think, remember, and reason to the point that it interferes with their daily life, and it could also interfere with your massage or bodywork session. The prevalence rate of dementia in geriatric clients is greater as a client ages. And it's not part of normal aging. This is where they've lost function and thinking and reasoning beyond what's normal for a person of their age. Dementia is not a disease, it's a syndrome, and it has a bunch of symptoms that would label a person with dementia. The symptoms are the loss of judgment. Their behavior changes. They can become extremely aggressive. They can't find the words to communicate, and other mental inabilities to have regular activities of daily living, their ADLs. It generally can become progressively worse over time, and it is irreversible. There are 7 stages of global deterioration with dementia, and we say out of the 7 stages, once a client gets to stage 5, unless you're in hospice care where you're working on the client in their bed, after stage 5 and at stage 5, if a client's coming to your office, that caretaker or whoever's bringing them to your office should probably stay in the treatment room with you. And that caregiver should be able to help your client dress and undress. Now, make sure this is a licensed caregiver dressing and undressing your client. You don't want any type of exploitive opportunities happening in your practice. But the client probably cannot dress and undress on their own at stage 5 or greater. And it's very difficult. There's a certain skill level, and unless you have the education, and it's usually not within the scope of practice to dress or undress a client, you wouldn't want to be accused of doing something wrong or unethical or outside of your scope of practice. You really need a second licensed caregiver there at your practice with you, at least one other person, to help that client. Also at stage 5, the level of lucidness with your geriatric client who has dementia can be quite diminished. They might forget who you are, where they are, what they're doing. And a licensed caregiver who is capable of caring for stage 5 dementia and greater would be able to help the client cope and get them back to where they should be, hopefully knowing that they're receiving some healthy massage and body work. We have some wonderful research studies that shows that massage and body work can be great for dementia geriatric clients. In this particular study that was conducted in 2012, it was titled The Effects of Slow Stroke Back Massage on Minutes of Nighttime Sleep in Persons with Dementia and Sleep Disturbances in the Nursing Home. They found people who were 65 years and older in the nursing home and provided them a 3-minute slow stroke back massage. And the result from just a 3-minute massage showed that these geriatric clients with dementia who were suffering sleep disturbances in a nursing home, they slept on average 46 minutes longer after a 3-minute massage. Geriatrics with dementia and other cognitive impairments can become aggressive and they can experience behavioral changes. I worked in one nursing home where little old ladies were swearing at each other and saying really rude things to one another, and their kids would be there who would be my age in their 50s, and they would pull me aside and say, listen, this is not normal. She was never like this. This only happened as her dementia got worse. And it also happens with Alzheimer's clients as well. And you really have to have a thick skin and understand that it's nothing really personal against you. It's just something that this client, they no longer are thinking clearly. And sometimes that can affect their responsibility or professionalism or their ethical conduct as well. In this 2010 research study titled The Physical and Psychological Effects of 6-Week Tactile Massage on Elderly Patients with Severe Dementia, and it's usually severe cases where you would see those severe personality changes. In this study, they did 30 massages, and they were 20-minute massages between 4 and 5 p.m. And the time is kind of important because sometimes earlier in the day, your geriatric client might be more lucid than later in the day. Usually, as time goes on, as they become more tired, the dementia side effects and symptoms can become more severe, and that's when you can see those behavioral changes quite clearly if they have them. And what they found with this study is after 6 weeks, they call it tactile massage, which means it was a hands-on massage. It wasn't a massage gun or thumper or anything. It was literally a massage therapist massaging them for 30 times. They found that they had significantly decreased aggressive scores. Okay, and that's really important because working with geriatric clients can be trying and challenging, and after a while, caregivers could possibly become bitter. They're trained not to be, but how can you not be sometimes resentful or upset with somebody who's swearing at you? So it's nice to know that when these geriatric clients are receiving massage with a severe dementia case, that they're actually improving on their score of aggressiveness. In 2008, another research study was conducted on dementia clients in nursing homes. They provided them reflexology for those who were experiencing pain, and they found that the reflexology bodywork helped decrease their pain. Now, in addition to just normal cognitive impairment and dementia, which is very common in geriatrics, 1 in 3 geriatric clients usually has dementia by the age of 85. There's also Alzheimer's, and Alzheimer's is regularly a top 10 cause of death in the United States. We've become quite good at treating other diseases, but Alzheimer's is something that is just increasing and on the rise. In 2022, there were over 120,000 deaths attributed to Alzheimer's alone. Alzheimer's disease is the most common cause of dementia. It's a progressive disease of the brain, which is only diagnosed after death, once they can open up the cranium and examine the brain. Alzheimer's disease is not a result of physical injury, it's simply a deterioration of the central nervous system of the brain. It's considered irreversible, although there are some medications out there that are thought to slow its progression, because Alzheimer's disease usually progresses to become worse and worse. Symptoms include difficulty remembering recent events or conversations, and they might even not remember their own name or your name or their child's name. They might not remember what they had for lunch or what they like for massage or bodywork, or if they've ever had one before. They might be depressed. They usually have impaired judgment in addition to impaired physical and mental abilities. They can be disoriented and confused, and they might think you're their daughter or son, or even spouse. They can have behavioral changes. Many times you can see Alzheimer's clients, in addition to dementia clients, become aggressive as their cognitive abilities continue to become more and more impaired. They might show a lack of interest or enthusiasm or concern for things that they once liked or enjoyed. And this is all very normal and typical with Alzheimer's disease. In advanced Alzheimer's disease stages, they can have difficulty walking, talking, or even swallowing. And you might ask yourself, well, how does someone die of Alzheimer's disease? It's usually they develop infections. They certainly do not have a lot of hygienic care. With Alzheimer's disease, they're usually in a full-time nursing, hopefully an Alzheimer's unit. And with Alzheimer's clients, I had one who she just stopped eating and drinking. And she was a DNR, which is do not resuscitate. And so they didn't do feeding tubes or saline lines or anything like that. And she died within 5 or 6 days when she just decided she wasn't going to eat or drink anymore. And it was very sad, but the best things that we could do was make her comfortable. One of the things that made her comfortable, just like an hour or two before she died, with her daughter, we massaged her with these really nicely scented lotions. And you could see the corners of her mouth smiling. She hadn't opened her eyes for a couple of days and she was not responsive, but she died smiling within an hour of that application. So Alzheimer's is something that's quite common in geriatrics, and the severity of the disease can be where you might not notice it to it's really noticeable and hard to work with. Believe it or not, we do not know why Alzheimer's disease happens. There is no physical injury or trauma that creates it, but there are a few risk factors that make the chances of acquiring Alzheimer's greater. Risk factors for Alzheimer's disease include age. You do not see 20-year-olds with Alzheimer's disease. As you age, you're at higher risk for Alzheimer's. And there is now a test, a genetic test, that analyzes a certain gene, which if you have that gene within your genetics, within your family history, you are exponentially at greater risk to develop Alzheimer's during your lifetime. Changes in the brain begin years before symptoms appear. And the client might they might be in your treatment room and you have a geriatric client there wondering why they're there, how they got there. That's definitely a sign of some type of cognitive issue, and they should be referred to neurologists for further testing. Researchers are studying whether education, diet, and environmental play a role of developing Alzheimer's disease. We don't know if there's environmental influences that can contribute to it, such as certain chemical exposures and so forth. And scientists are finding more research and evidence that some risk factors, such as heart disease and stroke, high blood pressure, and high cholesterol, may increase your risk of acquiring or developing Alzheimer's. And there's growing evidence that physical, mental, and social activities may reduce the risk of Alzheimer's disease. I currently live in the Villages, which is a retirement community, and I play bridge, which is really popular here. It's one of the largest bridge clubs in the world. And one of the reasons many people are playing is to improve their cognitive abilities. Alzheimer's is something that you really want to be aware of when practicing geriatric bodywork and massage, because it's one of those diseases out there that has no cure. And while it's a top 10 cause of death, it's expected to rise from like the 6th or 7th top 10 cause of death to a number much higher, maybe the 3rd, 4th, or 5th cause of death by 2050. And that's because not only is there no cure, and medications are not terribly helpful with it, but modern medical interventions for cancer and heart disease have become so good at preventing fatalities or prolonging life. Alzheimer's is one of those diseases where we really don't have much medical intervention as the patient declines, sometimes rapidly, sometimes they'll live for years with terrible symptoms, and they're just kind of existing and not really living. Now, with Alzheimer's disease, it's not often caught or diagnosed. It can't be diagnosed until after death, but many times it's missed. And so it's already thought that Alzheimer's disease contributes to more deaths than what we already have on record. Now, in your companion workbook to this home study course, there are the 7 stages of dementia, which I'm not going to review. You can review those on your own in your workbook if you want to review those in depth. What I am going to review with you, and it's also in your workbook, are bodywork or communications with cognitively impaired clients. Now, if the client doesn't know where they are, they're frightened and so forth, that's not the best place to provide treatment. You should always make sure that they feel safe and comfortable in your workplace, or if you're in hospice care or a nursing home, that they always feel safe and comfortable. That's one of your number one priorities. And to help establish that safe and comfortable feeling, we advise the following. There's fairly common conduct that is applied for cognitively impaired geriatrics, and you can find this almost anywhere on the internet. I did not come up with these 10 steps to working with cognitively impaired geriatrics, but I did modify it for licensed massage therapists and body workers. For your cognitively impaired clients, you want to ask yes or no questions. This helps avoid confusion. You want to give simple choices where the client has a good chance of providing a successful response. It's important to have a positive attitude when working with a cognitively impaired. That means have a positive mood, positive tone to your voice, positive body language. It's important to move about slowly, speak slowly. If they're sitting, sit with them. If they're standing, stand with them. To create that simpatico vibe where you're in their space with them and they can focus on you. Because if they lose their focus and they don't know where they are, you want to remind them who you are, what your relationship is to them, and anything else that can help them refocus to that moment of why they're there and what the agenda is, which is likely to receive massage or body work. If they really don't know who you are and there's no one there to help you, you don't want to focus on that. I would focus on the body work. How does this feel? Is this okay? You're receiving a massage or reflexology or whatever you're trying to provide for treatment. And then I would say, and my name's Selena, I'm your massage therapist. I'm here to provide your foot reflexology today. And then hopefully that will help remind them why they're there if they have that loss of cognitive moment. It's important to be clear in your communications, slow down your communications so it's easier to understand each word that's being communicated, but you don't need to shout. And several times, especially with new and inexperienced staff in nursing homes and hospice care, I'll see an orderly kind of shouting at their client or patient, and that's really unnecessary. They usually don't have a hearing problem as much as they don't understand what's going on. So make sure that even though you might be frustrated or it might be scary that your client has lost almost consciousness of what's going on, you need to stay calm and speak slowly and clearly and make sure that your client is not further alarmed by your own conduct. If you've followed everything that we've recommended for you, you're speaking slowly, you're using positive communication and non-complicated words as well. You want to make sure that they can try and follow your communication. You reminded them who you are, what your relationship is to them, and why they're there. Anything to help them remember what's going on if they've lost a moment and don't understand what's going on. You can take a short break from trying to get them to remember, and maybe in a minute or within a couple minutes, remind them again. My name's Selena. I'm your licensed massage therapist. We had a 30-minute foot reflexology today. We're about 20 minutes into the 30 minutes of session. We have 10 minutes left. How does this feel? Does this feel okay for you? Would you like anything different? Those are the types of communications you should ask. And just simply reminding them, be patient with them and yourself. Hopefully they'll have a moment of clarity and come back to you mentally. Now, when you have a client who's losing consciousness, like their surroundings are no longer familiar to themselves, I do not recommend that you have these types of clients undressing for massage. We teach something called a sweet session, and that's something that you should be providing with your client to allow them to get onto your table and receive body work without getting undressed. Because when someone's naked, they might feel threatened if they don't know where they are or who you are and why you're touching them. So when you when you have these cognitively impaired clients, stage 5 of dementia or greater, or somebody with Alzheimer's who is, here for one moment and mentally vacant the next, those types of people, I might keep them dressed in a corporate on-site chair, massage chair, if they can physically mount into that chair, or on a treatment table. Sometimes you'll just be working in their hospice bed, and that's okay too. You don't necessarily need to have them get undressed when working on them in their hospice bed. They can stay clothed and still receive things such as reflexology, hand and foot massage, and sweet sessions, Reiki, and more. Body language is really important when working with your clients. Now, if they're pronated, and some seniors cannot be pronated, some seniors, you might just want to keep supinated. It's easier for them to dismount the table. It's easier usually for them to breathe in a semi-recumbent position where they're slightly inclined for the head. It makes breathing easier for some geriatrics, especially with pulmonary or cardiovascular issues. If you're working on them, they're like, what's going on? Like they don't understand why they're there. you need to be cognizant of where your hands are, especially on their body. If you're working up their legs towards their thighs, I might just move down to the feet and do foot massage until you've reminded them. My name's Selena. I'm a licensed massage therapist. We have a 60-minute full body massage today. Right now I'm massaging your feet. We have 20 minutes left. How's this feel to you? And if they're like, oh yeah, that's great, then you are slightly safe to proceed. But if they're like, I don't know who you are, how did I get here? You just might want to move over to their hands, cover the leg if you were working on the leg, and move over to the hand like you see this woman who's holding the hand right here. Now, obviously, this woman is not receiving massage right now, but usually going back to the hands and holding the hands is a safe place to be. If you're doing things in and around the face, that could feel threatening to them because they don't know what you're doing and who you are and why they're there. So just try and use warm, supportive language and try and get into a safe space. Remember, safety and comfort is first for your geriatrics and cognitively impaired clients. And once they feel safe, then you can proceed as you feel fit. Being able to diffuse a situation when a client is in a crisis moment, they don't know what's going on, that is more important than your hands-on skills, believe it or not. Because if the client doesn't feel comfortable or safe, it doesn't matter how great your hands are or your massage or your modalities are. They feel scared and uncomfortable, so they're unable to enjoy it. So it's really important. Some people I've seen, grand licensed massage therapists, do the best work I've ever seen before. But if you don't have patience, working with people who are cognitively impaired is probably not the right route for you. It's very easy for a situation to escalate with a cognitively impaired client, especially if they exhibit abusive conduct when they don't understand what's going on or they are just, mentally lost. Okay, so when we're practicing, make sure that you can try and follow all these steps. And there are other things you can do to try and get them back to the moment, such as commenting on things. If you went to their house or hospice care or hospital, you can say, wow, this is a really lovely room. If they've been outside, it's a really nice day today, or, it's unfortunate it's raining today, but luckily we can make a good use of our time with this massage treatment today, seeing it's raining outside. If you know their family, oh, I think your daughter is lovely, your sister's a wonderful woman, I met your husband, very nice man, and you can say their name. You want to try and bring their attention back to you and help remind them who they are and hopefully why they're there. You can take a pause or a momentary break. You can have someone else, if they're around, say that spouse or child, or when I say child, usually with geriatrics, they're in their 40s or 50s, right? Or even like nursing staff. Hopefully they have a regular nurse or attendant or orderly that can come in and, hey, Mrs. So-and-so, how are you feeling? Is the pillow okay? Do you want to get on your side? Usually you like it on your side. Is that more comfortable for you? There are many ways that you can approach working with cognitively impaired people, and many different approaches that can help them feel more comfortable. You just simply need to know all these little tidbits to be able to get there. For those of you who are new to working with cognitively impaired clients, you might not know that sometimes they can remember the past, like 40 years ago, easier than they can remember what happened 4 minutes ago. So the past and past favorites and loves and stuff like that is usually easier to remember than what's going on today or yesterday. So when you have a client who's experiencing that loss of moment of where they are and what's going on, you can also reminisce or bring up things from the past to try and remind them of who they are and where they are and stuff like that. Because once they can start recalling who they are, that can help them refocus about what's going on right now as well. And I'm going to give you some more examples. This is specifically when I'm going to hospice care and nursing rooms and stuff like that. Kind of look around the room. Sometimes they'll have a favorite color, everything's in purple. Or sometimes they'll have things like their favorite team, like Red Sox or the Miami Dolphins or something like that, plastered all around. So you can say, oh, have you been able to see the Dolphins game? I know that you love football. Or, oh, I love purple. I can see that purple is your favorite color. Helping them remember what's going on, who they are, what their likes are in that reminiscing style can help them become more cognitively aware of themselves, and hopefully their surroundings will shortly follow after there. That's when you say, oh, and my name's Selena. I'm your licensed massage therapist. We're here doing your massage or body work today, and so forth. You can ask them questions. Have you seen your son lately? I mean, hopefully their son was there yesterday and they haven't, gone rogue and they're ghosting their parent or something. I always try and check in with the nursing station. Hey, any updates? And any recent visitors. Sometimes they'll have a favorite lunch. Oh, today's turkey day. Are you looking forward to your turkey lunch? Oh yeah, I'm in a nursing home. We have turkey on Tuesdays. So those types of things of knowing little tidbits and facts about your client and being able to share them with them or ask questions about them, that is a great way to keep them cognitively engaged so that you can have a successful session. When you know that you're working with a cognitively impaired client, it's really important to be reassuring when everything's going well. Don't just take it for granted that it's good and always going to be good, because it can deteriorate rapidly and often, especially over time with the cognitively impaired clients. So when they do something that you like or want, or you have this positive exchange or interaction, you want to acknowledge that everything is going well, because they might not know. But if you're acknowledging it and promoting this good interaction, then it helps them feel comfortable and safe. So let's say you want to ask them about pressure. How's this feel for you? Would you like more or less pressure? If they're like, no, that's good. Oh, that's great to hear. I'm using a good amount of pressure. At any time, if you want more or less pressure, please tell me. I'm so happy you told me. So providing that reassuring conduct. Hey, great job rolling over. If they rolled over onto the table, let's sit up. Great job sitting up. Let's lie down. Great job lying down. That constant reassurance that they're doing a good job. Everybody wants to do a good job in life, right? But when you're cognitively impaired and you don't really understand your surroundings, sometimes you feel lost and you probably don't know if you're doing a good job or not, and you don't want to feel like a failure. So provide that reassuring language, that reassuring conduct, that all is good when it is good, so that your client can feel good about it. I want to talk about rolling over onto the treatment table for your agile geriatrics who might be cognitively impaired, because this is probably one of the more difficult things to do with somebody who has dementia or Alzheimer's but still wants things like full body massage, pronated and supinated. Now, sometimes providing directions like, I need you to turn over or turn towards the wall. There's walls on both sides of you. So which wall are you talking about, right? We have to be really clear with our communications. So I'm going to give you an idea here of how you would instruct your client to change from pronated to supinated, or supinated or to pronated position. And hopefully you can use this language in these instructions for other treatment tasks, such as mounting and dismounting the table, when you explain things in these types of detail. So when you need to have your client roll over, you would say things, okay, we're going to have you roll over now. We need you on your stomach or on your back. And I would say things like, first, please look at me, so that, they've done something. Okay, good. I'm glad we can see each other now. Great. So you want to encourage, that reassuring, great. I'm glad to see you now. Great job. Now, the next thing you would do is, I need you to roll over onto your side. And when they roll over onto their side, And cognitively impaired clients, some of them will be agile enough to roll over, mount, dismount the table quite easily. Some of them no, but for those who are, when they roll over to their side, I never say, I'm going to have you roll over to your left or right side. And I definitely don't pick the sheet up into the air. I pitch a little tent so the sheet is still covering their right and left hand side. Okay, we don't want them to feel naked or vulnerable at any time. That's probably going to escalate things quite quickly. So when they roll onto their side, let them choose what side, and then you're going to focus on making sure that they don't fall off the table. And you're going to do this with your arms or your body to block them from rolling off the table. When they roll onto your side, again, great job, awesome, you're doing great work here. Good, good, good. That's a reassuring contact you want to say. Now I need you to roll onto your back or stomach, whichever way they're rolling, with more praise when they get there. Okay, great job. We're lying on your back now. That's excellent. I can work your arms and legs now, and we can do your scalp massage. Great, great work. So those are the types, again, be really reassuring. And then adjust the bolstering as needed. Hopefully you'll remove the bolster before you ask them to roll over. Especially with geriatric clients, it's important to bolster them so they don't get back aches or leg aches from being lying flat on a table. When you're putting the bolstering back in, either underneath their knees or underneath your ankles, you do want to ask them, I'm going to, put this bolster underneath your knees for a moment. Can you lift your knees for me for a moment, please? And hopefully they can do that for you. You can repeat yourself. Just give it a second if they don't lift them. Can you please lift your knees for me? I need to put this bolster underneath your knees. It'll help your low back and make sure you're in proper alignment. Does this feel comfortable for you? Let's see if putting something under your knees will make you feel more comfortable. Let me have you lift your knees. And if they're not following along, you can take a short break. And then come back to it, or if they're not following along at all, you might skip it. I don't advise that, because if they're in proper alignment, if it's in proper alignment, then they might have aches and pains after the session, especially if you're doing like an hour-long session. So these are examples of how you would communicate with your client, and with that amount of detail, you can apply that to any other aspect of your treatment. It's recommended to keep things light when working with cognitively impaired clients. We don't want to get really complicated or heavy discussions about death or other things that are not within your scope of practice. We want to have your client enjoy their session. And I like to even joke around with my clients. Sometimes I'll even tease them. Some people might not agree with that aspect. It depends on your personality and what you're able to get away with some fun and laughter and lightheartedness and just overall pure joy. I've written a lot for Massage Magazine, and in one of the articles I wrote, in the middle of July, with my cognitively impaired clients, I might say something like, oh, it's snowing outside. And this is after they've asked me like 6 times, how's the weather today? How's the weather today? And it might be July, and it's a hot sunny day, but this time I'm going to say it's snowing out there. And it makes them stop and think for a moment. They'll look out the window and it's sun shining and they don't see any snow. And I'm like, oh, you got me. I'm just kidding. And have a moment. Just because somebody's cognitively impaired doesn't mean that they can't enjoy a good joke or a little bit of teasing. I wouldn't do more than one tease per session, but it shows them you're human and you're having fun, and it's a safe environment where they can have fun too. Keeping things lighthearted can really make your time more enjoyable with your cognitively impaired clients. As I wrap up our discussion here about nervous changes with your client, whether they're in the peripheral body where our nervous system deteriorates and atrophies and slows in response with age, or the central nervous system where we have some cognitive issues and impairment that can happen over time beyond normal aging. Normal aging, we all have cognitive moments where we forget why we walked into a room or somebody's name, which is more than, when we were younger, we were spry and this never happened, right? I want you to think about caregiving. You are a caregiver as a licensed massage therapist. And when working with geriatrics, you're often working with other caregivers, especially for those who are cognitively impaired. And we've just discussed how to communicate with them and provided different suggestions on how to have a successful treatment with a cognitively impaired client, give you some tips on how to create more successes and greater successes and avoid hopeful potential disasters. It's very hard to provide good quality caregiving. We're all human, we all have emotions and so forth. But when you're able to achieve that, it's really rewarding. When you're working with other caregivers, they might be burnt out, exhausted, especially if the client remains at home and a loved one is providing full-time caregiving. And there's something called respite care where you can come in and, give them an hour off and you're providing the care for that geriatric client for that small little 1 hour. You want to kind of work as a team, recognize that they might be in a bad situation or a bad area. They might be overwhelmed. And the more patient you are with all of these various scenarios, the more successful your treatment and practice with geriatrics will be. Now I'd like to review hormonal and endocrine changes in geriatrics. Our endocrine system produces a number of hormones for our function and survival. And one of the steroid hormones that it produces is aldosterone. Aldosterone helps balance the fluid and salts within the body. It helps with blood pressure and other functions. However, as we age, the amount of aldosterone that we produce to help keep the body in balance, it's reduced. It's less and less with the older you become. So that is one of the contributing factors to postural hypotension, is that when we have less aldosterone production, as our hormonal production reduces with age, it can create a number of symptoms and side effects, such as lightheadedness and fainting. Helping your geriatric client dismount the treatment table is vital because that's one area for a number of reasons, whether it's they're being treated for high blood pressure or reduced aldosterone production due to hormonal changes as we age. There's many different factors that can contribute to a client falling when they dismount the table. So you're going to hear us repeatedly say, be careful when dismounting the table, because there's a number of factors where the client could feel lightheaded, fall, and hurt themselves when dismounting a treatment table. Our parathyroid glands, which are part of our endocrine system, produce parathyroid hormone, which is thought to control and balance our calcium and phosphate levels within the human body. As we age, the parathyroid hormone actually increases, and it's thought that this can be a contributing factor to osteoporosis, especially as the body leaches calcium from our own bones for our own human function. We need calcium to function for muscle movement and more. As we age, calcium is not well absorbed through the intestines of the body, so we need to get that calcium from somewhere. And your parathyroid glands are the ones that are trying to regulate that calcium balance within the body. So it's thought that the parathyroid glands are actually a contributing factor as we age to osteoporosis, because it's going to find calcium somewhere. And a great source of calcium within our human body is from our own bones. The thyroid gland, which is also part of the endocrine system, helps regulate heart rate, blood pressure, temperature, and metabolism. However, believe it or not, our thyroid function starts to decrease at age 20. So that's a normal part of aging. Some of us have better thyroid function than others, which is evaluated through testing, and sometimes people receive thyroid replacement hormone medication and more to treat thyroid disease and other conditions. Our thymus gland, which is also part of the endocrine system, is a vital gland that helps produce T cells and stimulate T cell production for your immunity. So that's why with geriatrics, they have weaker immunities. Our thymus gland literally deteriorates as we age. At birth, your thymus gland is about half an ounce, or what the same weight of like half a slice of bread would be. At puberty, it becomes like a full slice of bread weight. At 25 years of age, it's a little bit less than a full slice of bread. So at 25 years of age, your thymus gland is already deteriorating. By 60 years of age, you're back to what you were born with, about half a slice of bread of weight, or half an ounce. That's how much your thymus gland weighs. And by 70 years of age, your thymus gland is about a fifth of an ounce. So less than half of what you were born with, maybe the weight of a couple of drops of water. So that thymus gland, as it shrinks, its ability to stimulate T cell production as a response to bacterial or viral invaders within the body, it deteriorates. And that's why geriatrics have a poor immune response. They are unable to heal from infections, skin cuts and nicks, even bruising and more. Where an average 20-year-old might be bruised for a few days, a geriatric, if they have a bruise, it could last a month or longer. It's simply our immune system and our entire body responds slower over time. The pancreas is another endocrine organ that produces hormones. It produces insulin. However, the body becomes less sensitive or reactive to insulin as we age. So our ability to control our glucose sugar levels within the body lessens with age as we become less sensitive and responsive to that insulin hormone. And that usually starts to deteriorate at age 50. Diabetes is commonly associated with diabetic neuropathy, and it doesn't matter if they have type 1 or type 2 diabetes. Any form of diabetes can result in diabetic neuropathy where there's a loss of sensation. And you have to be really careful with the areas of the body where there's a loss of sensation. It's usually a local bodywork and massage contraindication to not massage an area that has lost nervous sensation, which happens with diabetic neuropathy. Also, if you do work on the area, it has to be with the utmost sanitation and safety, because if there's a little nick in the skin or cut in the skin, the client's ability to heal, because they can't feel it and they could be easily injured. They might not even notice a nick, and then it's become infected and then gangrene and resulting in amputation or even sepsis and death. It's really important to try and find alternative modalities for clients who have lost nervous sensation for any reason to avoid injury to your geriatric client. Even our ovaries and testes, which are part of the endocrine system, they're considered glands that excrete hormones. They even decrease in function over time and with age. The pituitary gland, another gland of the endocrine system, helps the entire body regulate the other glands. So your pituitary gland is the one who's kind of in charge. Your pituitary gland reaches maximum size at middle age, and then it starts to decrease its ability with function as we grow older. So, as we grow older, there's a general deterioration within the body's tissues, including the glandular function of our hormonal system as well. Remember, your hormonal system keeps your body in check for regular daily function. We hope that you enjoyed this free presentation of changes for the nervous and endocrine systems for geriatrics and seniors, and all the different accommodations that you might make for them in a massage or body worker practice. Remember that this is a training unit for one of our paid courses here at the school that we listed for free here on YouTube. If you want to take this training, you can visit our school and take it as a pre-recorded home study course at ceinstitute.com. This training unit is part of a larger course, and we hope you enjoyed, and to see you in another training.